morning. I am Dr. Brian. I am the owner of Allergic Wall Street, and today I decided to do a talk on your nerves. Since we are nervous system specialists, this is kind of what I do. I've realized that I've done PT talks, I've done subluxation talks, I've done all these types of different talks, but I've never actually talked about the nervous system. What was I thinking? Who knows? But we'll start and go from there. So we start from the top and we go down. So your cranial nerves come first. Most of these I do not treat. However, we have to diagnose everything under the sun to make sure we get you to the right kind of doctor. Cranial nerve 1 is your olfactory nerve. It's your nose. It helps you smell. It's actually one of the first things we lose as we age. A lot of people are born without the sense of smell. It is vital for our protective mechanisms, but since we live in modern society, it's not that big a deal anymore. As you go to cranial nerve 2, this is the one that all of your friends at the police department test all the time with their little flashlight back and forth. It helps constrict your eyes, and it's actually contralateral, so it means the opposite side. So when they're shining the light in this side, they're actually looking at the opposite one to see if it closes. That's cranial nerve 2. Cranial nerve 3 is the one that controls most of your eye motion. So it's the one that they're tracking back and forth, up and down, all of them except for 2. Those 2 happen to be cranial nerve 4 and cranial nerve 6 control the opposite motions in your eye. SO4, LR6 is how you would remember that, but nobody in here cares. So we're going to skip over that one, and we'll go back to cranial nerve 5, which is the sensation part of your face. It's your trigeminal nerves. Why is it called trigeminal? Because there are 3 pathways. It goes towards the top, towards the middle, towards the bottom. Very easy to test through sensation. You have somebody close their eyes, and you start pressing through those different areas, light, hard, and you can see if that one's working correctly. The most common irritation for that one is affected in Bell's palsy, which a lot of people know. It starts twitching in the eye. It usually only affects one side versus the other. It is more treatable than most people realize, but that's a conversation for a much longer day. As you go to cranial nerve 7, you get to your facial nerve, which is the muscle portion of the face. So it would be smile, frown, all the way up until you get to the tongue. That's controlled by cranial nerve 12. So anything that moves from here down is cranial nerve 7. Is an easy way to remember it. So then as you get to 8, that's hearing. So you start by taking your fingers out, and you're supposed to be able to hear about a foot away from yourself. Most individuals can hear much more than that. And then there's also the ringing. So there's bone conduction, and then there's air conduction, are the 2 that we have to test to make sure it's working correctly. And you do that by pressing up against your mastoid, which is part of how we hear. You should be able to hear there longer than you can out in air, because there's no differential. As you go to cranial nerve 9, well, where do we go now? You go to your tongue, and it's the front part of your tongue, the first third of your tongue to be exact, and it does sweet taste for the most part. Then cranial nerve 10 is the back half of your tongue and half of your uvula. And then, so it helps with bitter. It's also your vagus nerve, which we call the wanderer. It is controlling your heart, controls part of your lungs. It's part of, links into your autonomic nervous system, control a lot of things you don't have to think about every day. Cranial nerve 11, the first one I can actually treat of all of those, is your spinal accessory nerve. It leaves your head. It controls your upper trapezius. When you have torticollis or an upper trap spasm, you end up like this. That's where I come into play more. These things are much more treatable, much more correctable, and we don't have to send you to an ENT or an ophthalmologist, or other type of specialist to treat other disorders. As you go to cranial nerve 12, it controls the top part of your forehead. That's how you test it, is to wrinkle your forehead. When one side works and one side doesn't, go to the ER because a cardiovascular incident is happening. So that's an easy way to test if you're not sure if somebody's having a stroke or not. Have them wrinkle their forehead. If one side is working, one side's not, it's time to go to the ER. As we go down, we're finally to the cervical nerves. Huzzah! So it's actually where we spend most of our time. So cervical nerve 1, all the way at the top, back here, controls part of the front part of your head, but then most importantly is the most common cause of headaches, dizziness, lightheadedness. All these things are affected by that nerve. Why is it so important? Because that's where the nervous system is at its largest portion of the cord through there, and then it gets smaller and smaller as nerves come out. It accounts for about 30% of the motion in your cervical spine. When you go to cervical nerve 2, or C2, then that controls the other 60%, and then the rest of our neck really only does flexion and extension, but very small portions of it. Almost all the motion of your neck comes from the first 2 vertebrae. It controls the rest of your head also, and then once you go to C3, you're talking about the back of your neck is where it controls. C4 is the front of your neck. Once you get to C5, it gets a little more interesting. That's when it starts going down the arm. It's part of your brachial plexus. Sometimes it stops and ends beforehand, and that's just a genetic abnormality, but it doesn't cause any long-term issues. And once you get to C5, you're out here. C6, a little farther down. C7 is these fingers here. C8 is through here. And then T1 is back up and under. How do you remember all those things? A lot of memorization over the years. But it makes differential diagnosis very easy because you know exactly what area to test, you know exactly what muscles are controlled by that. And then most people in here start knowing the named nerves. And the named nerves are hot-buttoned issues because we can add itis to the end of them and we can call it a disorder. But you can get much more specific by calling it the segmental level versus calling it the named nerve. Once we get down to your thoracic nerve plexus, this is actually the easiest area and the least affected for the most part. It just follows the rib. So T1 follows this rib, T2, T3, T4, it's across the nipple line, then you just keep working your way down all the way to T12. What they control is part of your lungs. They also control part of your digestive system. So when they start affecting other systems, they cause like heartburn, indigestion, gastric reflux. All these things can be affected by those nerves. It's also where your autonomic nervous system lives, is from T2 to T7 or 8, depending on the individual. And that controls vasomotor, pseudomotor, and pilomotor functionality. If you want to know what those are, that's a bigger one-on-one conversation. But they're things we don't have to control, mostly blood vessels and how those function. As we move down, we get to the more exciting part again, which is lumbar, which is where the most common injuries occur, which is where most disc injuries occur, which is where most pain occurs, and they end up going down your legs. Well, first, they control the rest of your digestion. So constipation, diarrhea are things that can be affected by those nerves. And then as you go down the legs, you go to L1, L2, L3, L4, and then L5 goes into the big toe, S1 comes up the heel. Well, what happens next? We go into the sacral nerves. And the sacral nerves live back through here, and they are a bullseye around the center. So you start at S1, and you work your way out of your posterior region. So that's differential diagnosis 101. These are things I test on a consistent basis. I'll go through and I'll test each one of these areas to make sure that it's working correctly, that there's no major system dysfunctions. And then we work our way out from there and test muscles and myotones, dermatomes, to make sure that it's not something more significant. That's the end of this topic for today. If you have any questions, please let me know.